Hi.
How's it going?
Good.
Welcome.
Thank you.
Where are you coming from?
Belleville, Pennsylvania.
Pennsylvania.
Mm-hmm.
Okay, who'd you come with?
My mom.
Your mom, and your mom happens to be a patient here.
Yes.
And she came with her husband a couple of times, and we do have a few videos of them, and I guess they did well and wanted to bring the daughter.
The daughter wanted to come.
The daughter wanted to come.
Mm-hmm.
Why?
Because I was having issues with my neck and my shoulders and my back.
What do you mean?
Well, I took a couple falls.
Okay.
And yeah.
Couple falls, home, working, schooling, doing chores around the house.
Home,
Okay.
kind of at school too.
And what was the major fall or major accident that you had?
Probably one of them would have been when the gate fell on my shoulder.
The gate fell on your shoulder? Did you do anything for it?
No.
Okay, what else happened?
Probably when I did my scooter wreck, when I flipped up over the handlebars.
Okay, did you break any bones?
No.
Okay, were you bedridden for any length of time?
No.
You just get up and go, right?
Yep.
Because you guys have to, right?
Yeah.
Who's gonna do it if you don't?
Yep.
Right? Okay. And Dad actually wanted us to share the story so he can actually see what's going on back in Pennsylvania also, right?
Mm-hmm.
The first day you came, what was going on? What were you feeling?
The first day my neck was having issues.
Okay.
My back.
Any shooting pains down the leg?
No.
No. What was the thing that was bothering you the most? Like, how is this affecting your quality of life? How is it affecting your daily routines?
My neck. My neck gets really, really tight.
And what does that do for you then? Like, what do you do?
What I do?
Yeah.
I put oils on it, and my dad treats it.
Okay. But what happens? Like, how is this affecting? Because you decided to come all the way from Pennsylvania, so this is obviously affecting daily routines.
I just kind of push through it.
Okay.
Just kind of ignore it.
Okay. Just ignore it.
Yeah.
Okay. All right. All right. Why don't we see where we're at today?
Okay.
I am going to go over some X-rays, so in terms of what I found and what we've been adjusting, and let's see where we're at today.
Okay.
Sound good?
Yeah.
All right, come over here. Let's watch you walk. She had a few things going on. She did do well and responded well with the first couple of visits. I just want to go over her posture, and let's take a look and see what we see. When we're looking at the scapula or the wing bones, we can see the right side is slightly higher than the left side. We can see it's a little more pronounced here, the musculature. You do a lot of work at home, don't you?
Yeah, I do.
Yeah. Okay. Now, looking at the curve, let's follow. We can see the line through here goes in, and right about here it goes flat, goes straight. Okay? Let's go ahead and watch her walk. I want you to walk towards the nervous system poster, regular walking. Okay, keep going. And as you're walking, are you feeling anything today from the first day? You feeling your back, your neck, your hip?
No, not really.
So everything's fixed?
Saying her back.
Well, my back hurt a little bit this morning,
Okay.
and my neck area hurts.
Okay. Can you walk on your toes, please? So she's got movement through her hips. There is a little bit of a wiggle. There was actually more wiggle on the first day. And what we're regular walking, we're looking at the dimples here. We want to see them move up and down. They are moving up and down. There is a little side shift to that left side. Go ahead and do it again, please. Walk again, please. So you can see the movement through the SIs. There is a little side shift to the left. Go ahead and have a seat. This is your full spine. You actually did come with a set of full spines from a couple of years back, and we did take new ones to see kind of where we're at. And I wanted to look at a couple of things here. This is your side profile. This is looking at you from behind. Now, on the side profile, the main thing we want to talk about is what? Her posture. And when we're running a plumb line through, we're running a plumb line or the arrow from L5 all the way up. it should bisect through C2 and C7. And what do we see here? So what we're seeing here, Anna, is that the upper body is behind the foundation. And when the upper body is behind the foundation, those muscles in the upper back here, your muscles here, are working a little harder just to keep you upright and balanced. And that's kind of what you're feeling, yeah?
Yeah.
Okay. Now let's go to the AP. Let's look at the whole spine. This is a picture in time. 24 bones in the spine, 7 in the neck called cervicals, 12 in the low back called thoracics, T1 through T12, 5 in the low back called lumbars, L1 through L5. And then this is the foundation of this whole building, so to speak. And the foundation is what? The foundation is the sacrum and the pelvis. And the first thing I just want us to look at is, are we symmetrical? Does that look symmetrical? Does the left side look like the right side?
No.
No?
No.
What's different? What's different?
I mean, it's off.
It's off. You can see the obturator. You can see this obturator looks bigger than this side. There's the pubic bone. There's the crease there of the bum, and you can see it's kind of tilted to the side and it's turning to one side. Yes?
Mm-hmm.
We can also look at the sacrum and see there's a slight bend in the sacrum here. And that's from any of those falls you may have had back in the past. When we go through the SI joint here, what we can see is there's a we're going through here. I'm going to change the contrast. And you can see the joint line through here. There's a little bit of scar tissue in here. When we go in through this side here, this side looks a lot better in terms of compared to the left side. Does that make sense?
Yes, it
Yeah.
does.
Okay. Now, from the foundation, if we don't have a level base and foundation, then anything going on in the rest of the body doesn't really hold based on this work. Okay?
Mm-hmm.
And if we look at go back and look at the overall, there's a little bit of curvature. It's nothing major. That's not my big concern for you. My big concern for you is your foundation, number one,
Mm-hmm.
level and balanced, and number two is that our posture is where it's supposed to be. So the body uses less energy just to rest, just to be. Does that make sense?
Yeah, it does.
Okay. All right, let's go to the numbers and see what this means now. So we have 232, 233, 9.5, 73, and 71. And then we have a slight difference in the leg lengths, 1.96 difference millimeter. So let's put it all together. What does this mean? I'm going to reference the left side because we have rotation of the sacrum on the left side. 9.5, 2.32. So when we're looking at the pelvis, typically this is how it works. The pelvis typically sits on a slight angle. When it misaligns back posterior, the vertical distance will be larger. When it misaligns forward, anterior superior, the vertical distance will be smaller. Here we have AS1, IN 9.5 with a rotated sacrum. So it's doing this. The left pelvis goes up a tiny bit, turns into the left, turns this way, and the sacrum on the left side goes with it. So your foundation is going which way? To the left. Yep.
Mm-hmm.
Foundation is going left, and which way is the spine going? It's kind of going with it, right? So one is trauma, two is posture and habits that contribute to it. Does that make sense? Meaning there's not a full disconnect. I talk a lot about that in the videos where the pelvis goes one way, the spine goes the other. Yours is not that case. You have the misalignment and you've kind of been favoring that side. So now as we've been correcting it, I know it's not it feels better,
Mm-hmm.
but it also feels a little weird
Yeah.
because it's not used to that, right?
Mm-hmm.
Does that make sense so far?
Yes, it does.
Okay. So our focus here has been what? Has been your foundation. That's been number one,
Mm-hmm.
right?
Yes.
Number two, we talked about skin conditions, generally speaking. And the way it was taught to me, looking at any skin condition is it always starts the way I was trained, kidney adrenal area. And when the kidney adrenals are not doing their job effectively or efficiently, we get the toxin buildup and it goes to the skin. Okay? Questions on the x-rays? Okay. Shall we get started?
Sure.
Have a seat over here, please. Starting at the base of the neck. So the videos I have of your parents, it says Amish couple or Amish man or Amish lady, and I need to correct that actually, because you guys aren't Amish, are you?
No, we're not.
You're actually Mennonites.
Yes.
Did
we
I
are.
say that correctly?
Yes, you did.
Awesome. T1. Because I had some comments that Amish don't really watch TV or use electronics, correct?
Yes.
But you guys do.
Yes, we do.
Awesome.
As we advanced, like as from our parents, sometimes we're called Amish Mennonite.
Amish Mennonite. So the Mennonites actually stem from the Amish? Is that what it is?
Some of them, not all, but some of them did, yes.
Got it. I got a tiny bit at T1. And you said you're feeling your neck, yeah, today?
Yeah.
What are you feeling in your neck?
Well, it's honestly kind of the left side.
The left side?
Yeah.
Is it tense? Is it tight? Is it sharp?
It's just kind of tense a little bit.
Tell them what you told me. Where's it starting?
It's starting at my head, kind of with a headache, and I usually don't get headaches.
It starts here on the left side,
Yeah.
above the eyebrow.
Mm-hmm.
Okay. Well, we have been doing some deep adjustments. Things have been shifting around. You've been doing your walks while you've been here?
Yep.
Your food has been good while you've been here?
Yep.
Eating well? Good. We got some at the mid-back around T6, T7. And a tiny bit on the sacrum left. Well, that's not as exciting as I wanted it to be. We fixed up most of it, Mom. Just playing. Let's go ahead and statically palpate.
So that's good news.
Yes, ma'am. T1, around T6, T7, and down in the sacrum. Static palpation. As I run my fingers down the spine, right there you can see still a little bit of swelling. It's definitely a lot less than what it was. 2, 3, 4, 5, 6, 7 more tender, Anna, or 6 more tender?
6.
Okay. Not 8. 7 is a tiny bit. 6 is tender?
Yes.
How about 5?
No, it's not.
6, 7, 8, 9. Okay. Now, also when we started, she was a lot more round in the back. So the foundation is still slightly behind, but when we started it was more like that when she came. Does that feel comfortable now to sit like that?
No, it doesn't.
Show me what's comfortable.
Like this?
Stand up for a second, please. Sit what's comfortable. So we still have a little bit of work to do, Mom. And a lot of this is going to be just getting back into movements, a lot of movements.
So I had a question.
Yes, ma'am.
Was it because of the posture she had? Was that being hard on the adrenals? Like, is that was making the adrenals work harder?
Good question. So we have the posture off, number one,
Yeah.
right? We had a few traumas, what mid back, low back, and up in the neck. The posture contributed to it, meaning it didn't allow it to heal, right? So even whatever adjustments were that she received back then, I don't know that she was instructed on posture and movement patterns.
Not as much. Her dad would.
We'll talk to Dad later about it.
Yeah.
So this is the area that controls the adrenals and kidney.
Okay.
And it's in a compensatory state. Now, long-standing compensations can turn into subluxations or nerve pressures. But did it start here? No. It started here and up here.
And there.
Yes, ma'am. And Melvin, if you have any questions, please feel free to give me a call. Now you can see it better. 15, 12 points. Yep, the sacrum. Scoot forward, please. Feet together. Let's check movement of the SI joints. Feet together. Open and close the knees. Open and close. Open wide, please. Good. Good. Right side only. So you can see when she does the right, the left is shifting. Do the left side only. When she does the left, the right is good. So this is still on the left SI joint. Scoot back for me, please. Now, starting here, this is L5, tender, S1, S2, more tender at S2 or S1?
S1.
All right. How about S3?
No.
S1, right
Yeah.
there. On the left side, on the right side.
They're about equal.
Okay, more in the center there.
Yeah.
Okay. All right, S1, T6, T6, S1. S1, we're going to do it slightly on the left side of the rotated sacrum. So we have a IN ilium with a rotated sacrum. The book says to do the sacrum when you have an IN and ASIN on the side of a rotated sacrum. We're going to do the Gonstead Leg Check just to confirm if that's her case. Because remember, when we have an x-ray and we have the patient, we're treating the patient, not the x-ray. Okay?
Correct.
You feel it more at the bottom there or there? Top one, bottom one.
Bottom one.
Second bottom, that's T2, that's T1 right there. Okay. Anna, we're going to do T1, T6, and before we do that, let's do the Gonstead Leg Check. Stand up for me, please. And you're going to go face down. Let me put some paper. I want your ankles hanging off the edge of the table, please. Going face down right there. Okay. Slide up. So for the Gonstead Leg Check, come over here. We're going to look at the ankles. And the first thing we're going to see is, we said the right one is slightly, left one is slightly shorter. And that's the same as it is on film. So the left one is slightly shorter. When we bend it, if it stays short, we do the sacrum. Hers goes long. So this is kind of opposite the textbook. Okay, short goes long. That's pelvis. Now, what do? We treat an x-ray, we treat a patient. We're going to treat the patient. Okay, Anna? You ready?
Yes, I am.
Let's do it, lady. Sit up for me, please. Okay. T1. T1 we're going to set as a PLS. Relax the chin to the left side. Good. Good. Nice and easy there. We're a little tense today. Gotcha. Look up. Let the left ear just fall down, down. That's it. Let's go over there. Just tensen up on resistance is futile, young lady. Because I'm gonna get it. Okay. Well, Mom, I try to be nice. It didn't happen. Okay, let's do it here. T1.
Just so she can walk the pain.
T1. There you go. Relax the shoulders. And that's the home run. Gotcha. Next is T6. 2, 3, 4, 5, 6. T6. Nice and easy there. Good. Gotcha. Alright, young lady. Walk it off, please. Back and forth a couple of times. As you're walking, take a couple of nice, deep breaths in. And how's the left neck feeling right now? The left side here.
It feels better.
It's different now? Are you still feeling it?
Yeah, a little bit.
Show me where.
Just kind of like all along here.
All the muscle from here or from
Yeah.
here?
From right here down.
Okay, come over here, please. Right side down, head over here, face that way. Top leg bent. Mama, she gonna get the cobra. You gonna get the cobra. You know the cobra?
No.
She don't know the cobra.
She's not been watching the videos.
Oh no, she gonna get the cobra. Melvin, she gonna get the cobra. There's the cobra. You know the cobra? Does this, right? We're gonna do the IN ilium. So we're on the PSIS. We're hooking it with the first, second, third digit. Good. Can you relax the shoulder? Gotcha. That's the cobra. Stand up and walk it up. Good. Mama, she's a tough customer. Sit up straight. Scoot forward. Now taking a couple of nice deep breaths. And down. One more. Okay. Let's rescope. Head down, please. Starting at the base. Neck is clear. Mid back is clear. Low back is clear. Let's retest it now. All the way back towards me. This is 5. Went up. Some loud cars out there.
Let's say.
S1. S2. Different?
Yeah.
Tender? Still tender there?
Yeah, it is.
Okay. Left side. Good. Tender.
No, it's not.
Okay. Right side. Good?
Yeah, it's good.
Okay. So, S1 is still a little tender. I'm going to use the drop board for her over there just to set it in a little bit without disrupting the pelvis, okay? Come over here, please. This is not textbook.
Okay.
Because you are not textbook.
That's what's
Because only a textbook is textbook. Slide them a little bit, please.
That's what's neat about what you
Slide.
do.
What's
You
that?
don't go just by textbook.
I mean, we have the textbook to we need a standard. We need, you know, some sort of foundation. Now, I don't need you to hold the legs, Mom. I need the drop board. Okay. Slightly on S1. Slide down a tiny bit, please. A little more. There you go. Now, let's continue. Ears. Shoulders. Nothing left. On your back, please. Check the ankles. More tender here.
Left one.
We're going to do left talus, AS talus, medial tilt, posterior fibula. Turn to your right side, please. Posterior lateral calcaneus. Sit up for me. And let me just test that. Let's test the pelvis and the sacrum. Scoot forward, please. Feet are touching?
Yes.
Cool. Open wide. Right side only. So when she does the right, there's less movement of the left. There's still the tissue pull here. Left side only. Is that different to open up now?
Yeah, it is.
A little bit more, right? Okay, scoot back for me, please. Now you're gonna get the buff and the polish. All right, walk it off one last time, please. Let me know how everything is doing. How's the back?
It feels good. It's sore though.
Sore. Yeah. How about the neck?
It feels better.
Sore.
Maybe a little bit.
Turn to the left, turn to the right. Good. Have a seat. Look up a little bit. Slowly open the mouth. Open, open. When she opens, you can see the right side comes down first and it deviates to that left side. Close. Watch again. Watch, Mom. Come here. Slowly open. So it starts to do this. Open all the way. Okay, so we're going to do her right TMJ today. I got a new one for you today, Anna. Okay, now the way we're going to do the jaw, you're going to open all the way. I'm going to guide it back in. Okay? Open, 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 open. Slowly close. There it is. Good. Look up. Slowly open. There you go. Pretty cool. Anna, do you have any questions for me?
No, I don't.
No? Are you happy you came?
Yes, I am.
Are you sure?
Yes.
You ain't acting like you're happy. Stand up. Squeeze my hand. There, we finally got a smile out of her. Squeeze. You tough lady. Squeeze. You sure you don't want to go to chiropractic college? You sure
I guess
you-
I'll have to think about that.
I think so. I think you got the hands for sure. She got the heart, Mama?
Oh, yes.
All right. If you got the heart and the hands, you can do really well and help a lot of people. Lunate. Scaphoid. Squeeze. Elbow. Lunate. Scaphoid. There. A little spicy, sorry. 5 times. 1, 2, 3, 4, 5. With your hands. 5. Squeeze hard. Squeeze. You are all set with me, Anna.
Thank you.
You're very welcome.